afternoon, doctor. My name is EshikaParuchuri, and I'm a sophomore at Woodbridge Academy. I would like to thank you, firstly, for joining me in this initiative. My main objective is to educate adolescents around the world to help them build a healthier lifestyle by working with experienced doctors across different specializations. Welcome to the Healthy Teens podcast. I hope you are keeping well. This month, I'm joined by Dr. Iram Fatima Shah, who specializes in physical therapy. She has experience in this field serving the New Jersey area, and she specializes in pelvic wellness with the Princeton Medical Center for Rehabilitation. And she has experience treating patients with conditions such as pelvic floor dysfunction, including urinary incontinence, frequency, pelvic organ prolapse, and constipation. For this episode, we'll be focusing on multiple issues related to the musculoskeletal system, like posture, muscle movements, and injuries faced by teens, as well as the steps that can be taken to have a healthy body and lifestyle. And now, Dr. Fatima, can you give us a little background regarding your experience in this field?
Absolutely. My full name is Iram Fatima Shah, and I work for Center for Pelvic Wellness, which is associated with Penn Medicine. Our specialty is pelvic wellness, pelvic floor, all related issues with that. Not just physical therapy. It is a very specialized field in physical therapy, which we are working with. And I do have my certification in lymphedema too. I am certified a clinical instructor too, and I am a trainer for low pressure fitness too. So I do have a certification in CAP-OB, we call it, for pregnancy and postpartum patients. So we kind of cover a lot of issues with all things related to pelvic wellness.
Very interesting.
It definitely is.
So let's dive right in.
Absolutely.
What is a muscle strain? How is it caused? And what issues does it lead to?
Okay. So the very first thing is muscle strain is when muscles move certain way. So there are like muscle cells which go like this hand to hand when the muscle is moving. So when muscle is not able to perform this activity and there is some kind of impact for some reason in this movement, that is muscle strain. And it can be caused by multiple reasons. It can be caused by the electrical charges which are not going in properly. It can be done with overuse of a muscle. It can happen when you have the faulty posture and muscle need to work for a long time in a certain position. Absolutely, it can happen anyways like that. So it is the fault of the muscle which is not able to perform the way it should perform.
Okay. And what are some long-term effects of untreated sports injuries in teenagers?
In teenagers, there are lots of, at this point, when I see patients, I see lots of issues which started when they were teenagers and they were doing all these high impact sports, and then that affect them. So depending how you train your body, training your body is very, very important. What happens with teens is when they get into these sports, because as we all think when we are teenagers that we are invincible, nothing can happen to us. So we do things without thinking. So when you're playing, if you would really like it, you are playing for 10 hours a day and you don't feel anything. Although you don't feel anything, but your muscles do keep that tension which stays in them. Okay, the wear and tear on the muscle can happen. So if the recovery is usually much easier in the teens, the the production of good blood cells and all the materials which cause the healing in the muscle does happen very quickly in teenagers. But when there is this wear and tear happen, when the healing happens with scar tissue inside the muscle. So remember the muscle we told that it moves this way? The
Mhm.
muscle fibers, the scar tissues are right in between the muscles. There is muscle tearing which can happen. There is muscle, kind of like, as you said, strains can happen. So all of these things stay in the muscle memory. So not just if we are not trained the right way, if we don't activate and we don't strengthen the muscles the right way, those scar tissues continue with the weak muscle throughout your life, and you get into adulthood with those scars inside the muscle, very tiny, very small scars, but they stay inside the muscle. And then we get older, as we get into the point where our body is not healing as well, and they start to show up. So some
Mhm.
of the kids, you have soccer and you did not do proper training, you did not strengthen the muscles to play soccer, the knees get hurt very much. If you're not stretching properly, when you are training for different kind of runs, you definitely a lot of wear and tear happen on the muscle. So training properly is very, very important in teenagers. That means that you gotta know which stretches you need to do. You need to know which muscle you want to use so you can actually warm up those muscles for your activity. So to avoid all of this, when you are adulthood and it stays with that, we need to train better today with
Mhm.
the right trainer.
Agreed.
Yeah, yeah.
So, based on what you've seen in your experience, how
Mhm.
have pelvic wellness techniques evolved?
Pelvic wellness is actually when I came into this field in 2005, when
Mhm.
we would tell patients or people, you have muscles in the pelvic floor, and they would say, what? What is that? What is pelvic floor? Okay, you tell me, Eshika, do you know anything about pelvic floor? What pelvic floor is?
I don't know.
Absolutely, that's it. What happens that we 99% of the people who don't know what pelvic floor is until we have an issue and you're seeing some kind of problem and your doctor says, I think you need to go for pelvic floor PT. And you are
Mhm.
thinking, what the heck is that? Especially teenagers.
Mhm.
So teenagers, especially if you get a female and male, sometimes let's think about what the pelvic floor is. I'm actually going to bring a model.
Okay.
I wanted to bring two models, not just one. So here I am. So if you look at this is your pelvis.
Mhm.
These are the bones. This is your backbone. And pelvic floor is that bow, with kind of
Oh.
bow-like shape right in the middle. These are the muscles of your bottom. So when you are sitting and all these muscles are on the bottom like this,
Mhm.
like this. Yeah. This is your pelvic floor. Now, what happens in this area is that whole body is right up and this area is right here. The pressure from the top, these muscles are holding them. For and all of our multiple viscera are inside the pelvic floor and they are getting supported by this. So if you look at the viscera, what viscera are there? Number one, your bladder is in pelvic floor. In women, uterus is in pelvic floor. So if you look at the pelvic floor, this is how it looks like. Kind of like first the bladder, then the uterus, and the third thing which comes with this is your colon. So all of us always sometimes feel like, I can't go to the bathroom very well. There are some patients who have constipation. Like, I'm very lucky if I go every third day. Although it should be once a week, once a day to 3 times a day, to all the way to 3 times a week is normal for going to the bathroom to pass your bowel. Okay. So, what does these muscles do? Why are they there? There is some function with that, right? So these muscles actually do 5 major functions. The first function is to provide uh, support for the viscera, which are in the pelvis and on top of the body, right? Like the bladder, the uterus, the colon, and the intestine, which are right above it to provide support for that. That's one function. The second function is the sphincteric function. Like if you have to pee, you need to be able to pee. But if you feel like, oh, it's not a good time, I need to wait, then you should be able to hold until you feel like holding. That is the job for this. The third function is sump pump function. It these muscles contract and push the blood back into the system. If these muscles don't work very well, the congestion can happen in the lower extremities and the pelvic floor. Okay. And then there is a sexual function of these muscles. The sexual pleasure is a part of these muscles. Now, and then the most important, which teens need to find out, which we all need to know, is stability. What is stability? Stability means that your lumbopelvic area or your core is able to provide good support for all the functions you do. Now, teenagers, lots of sports is very important, right? What they found out is, where they did the research, they found out that people who were throwing the ball, like the baseball players, their when their pelvic floor strength was less, and there was less stability in their lumbopelvic area in their hips, their throwing power was 30% less. So once they improved the strength and stability in the core and the hip muscles, their throwing strength got better 50%. 30% improvement in the strength and stability improved 50% throwing power. So think about this. Body is not separately situated. Everything is related, right?
Yeah.
So when you move your arm, your body has to be in certain posture to be able to move your arm. When you go for a run, what some teenagers are, I'm seeing a couple of teenagers who come to tell me that they leak a little bit when they are running, like a little leak when they are running or they're running fast. But by the end of the run, they feel that they're leaking a little bit. Small amount of urine, but they do leak sometimes. Sometimes men, the guys or women who pick up weight and not using their body properly, they leak a little bit when they are picking up weight. Even guys, I was seeing a guy, a heavy lifter, and he came to me because when he lifted overhead, he all of a sudden lost urine on the stage in front of all the audience because he was pushing so hard. The pressure management was not very good in abdominal area. So that's one part of it. Another part is women, and especially ladies, who have really bad menstrual cycle.
Mm-hmm.
They have a lot of pain in their bottom. Those are a lot of our patients because women, we think it's part of our life, right?
Mm-hmm.
All girls, all teenagers, part of our life. When we go through periods, we gotta have this pain. But some people do have the pain, some people don't. Why is
Yeah.
that? So that is where the physical therapist, pelvic floor physical therapist can help you. We can help, of course, the centric function. We can help you with stability and improving your strength and stamina. We can help you definitely with this pain you have in the pelvic floor and when during the period. Okay? There are multiple reasons for those, and we cannot go in detail why you have pain during periods, but we can help, physical therapists can help pelvic wellness physical therapists with that pain. Then the next thing is the sexual. As our teenagers are getting into this age of getting active, dating starts, and the sexual activity starts, understanding what is right, what is wrong, and understanding when the pain can happen, when you should not have pain, it's another training which can help with the pelvic PT can help with that. So lots of things which a pelvic wellness physical therapist can help you. The most important, which I want to really talk about, is improving the stability.
Mm-hmm.
Because core, everyone wants to look really good, right?
Yeah.
And the six pack core and everything. The important thing is what we don't understand is the packs are very good outlook muscles.
Mm-hmm.
We can build that muscle and we can look very good. But I have treated people who have defined six pack, but their core was very weak.
Mm-hmm.
You must be thinking, what? If you have six pack, you are very, very strong in there, right? Why? How come the core can be weak? So there are multiple muscles which are developed in the core on the abdominal. The core is not just the abdominal.
Mm-hmm.
Core is the local core muscles. The core muscles are pelvic floor muscles, your deep transverse abdominis muscle, which is right on the side of the muscle, and the muscles of your back. So all three groups of muscles create the deep core muscle. Deep core muscle activation is very important and it needs to be strong and coordinated no matter what activity you do. So whatever you are a soccer player, think about this. Your body needs to be stable. Your hips need to be stable for your legs to move properly, to be able to do all those maneuvers, right?
Mm-hmm.
Your football players, right? So the way they need to go catch the ball while they are running, something needs to be stable in the middle for them to be able to do that. Think about that. In the air, they need to go and catch that ball, right?
Mm-hmm.
What keeps you stable in the air? Why don't they fall right away? Because their core is stable and able to catch the ball. The stronger their core muscles are, the better their activity can be, the better their throw, the better their catching power, the better their ability to stabilize and pick up and jump up again. So that's why doing the exercises, not just for the crunches and everything, but the deep core muscles, pelvic floor muscles, your back muscles, and your deep abdominal muscles, activating them is very important. All right. I think that was a long answer to a small question.
Yeah. But it was very interesting to understand, the different, reasons why patients might be seeing a physical therapist. I feel like a big misconception might be, only if you need a referral, maybe you need to see the physical therapist. But seeing that there are many reasons, it's very interesting.
Yes, there are many, many reasons. And then the youth need to understand this, that your medical doctors are
Mhm.
very busy. They, whenever you go to them, they are specialized fields and you go to them, you tell them this is the issue, they see you and they give you. You are your own advisor.
Yeah.
So you need to go to the doctor and you have to ask, can a physical therapist help me with this
Mhm.
issue I'm having? Right? So you gotta stand up for your own self. You need to go to the MD and ask, can I get a script for PT? I have this pain every time I go through periods, and the studies show us that when you have this kind of periodic pain, you can physical therapy can help. So can I please get a script for that?
Mhm.
You can ask your doctor. Okay, I am playing in this game, and I need to be at my best. What can I do? Can you give me a script to do? Go to a doctor so I won't injure myself. I can
Mhm.
train better. So, or if you get hurt, that's what pelvic wellness is, or that's what wellness is. That before you get sick, you do something to make it better and won't have to wait till you get injured and then you see something.
Mhm.
So go there before you get to, before you are in trouble, to save you from trouble. So that's what my advice for the teens are.
That's
Your
good
own advocate.
advice. So I was also wondering, can musculoskeletal disorders be genetic or can they also skip generations?
So yes, musculoskeletal disorders can be genetic.
Mhm.
There are some of them which are definite, like osteoarthritis.
Mhm.
If
Yeah.
your parents had that or their parents had that, yes, it can skip generations too. But you might get that. It's a big winner of who gets mom's arthritis and
Mhm.
who gets dad's baldness, right? That kind of thing. So it definitely does skip generations too. It can be like there are certain diseases which goes in generation to generation, like osteopenia, osteoarthritis, osteoporosis
Mhm.
that goes from generation to generation. There is another EDS which can go from into generation to generation. EDS is Ehlers-Danlos syndrome, where your ligaments are very, very stretchable, very, very loose.
Mhm.
So it can go from generation to generation. Yeah, there are lots of diseases which can go from one generation to the next generation, or they are kind of genetic. It comes to you.
Okay.
Yeah.
So, what are three exercises that we should incorporate for a strong, for strong and healthy muscles?
The first thing, breathing properly.
Mhm.
So, Ishika, I want you to set up your camera a little bit down so I can see your shoulders, and there you go. So now what I want you to do is take a slow, full breath in. Slow, full breath in. Okay. All right. So what I noted is that your shoulders didn't move much, and I was not able to see the rib cage and your abdominals. So most of the time, when we ask someone to take a slow, full breath in, the first thing they do is they go,
Yeah.
their shoulders go up, their neck goes up, right? So that is one exercise which we all need to do, but not to breathe in your shoulders, in your neck. Do the deep breathing at least 5 minutes every day, especially when you are lying down in bed to fall asleep. Do the deep breathing and do the breathing in your lower rib cage.
Mhm. Okay.
In your lip rib cage. So put your hands right here
Mhm.
on the rib cage, and you inhale on your both sides of the rib cage, and you inhale into your hands, moving your rib cage outward. So inhale, And exhale. Did you feel your rib cage moving outward?
Yeah.
Beautiful. You are some of the lucky ones which can do that, but a lot of people cannot feel the movement in their rib cage. So moving, paying attention to where you are breathing and moving your rib cage out when you inhale and let it go when you exhale helps tremendously to activate the muscles all around the midriff right here.
Mhm.
So diaphragm is a big muscle which is like a sheet underneath in the abdominal area. When you inhale, it should come down. When you exhale, it goes up. So activate, and that muscle is very important from um, you're having the when you are having a mental breakdown. The first thing what people say is breathe, breathe, right? Why
Yeah.
do they say that? Because the breathing calms the nervous system down, right?
Okay.
And your diaphragm controls that breathing. If you breathe, if people tell, you are getting all, if somebody is getting all nervous and all hyper, and you tell them breathe, 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 and they breathe, they're going to create more of the trouble for themselves. So
Mhm.
inhaling, doing the breathing exercise, knowing how to breathe properly is the first thing which all teenagers and adults and young children should do. Okay. It helps us multiple ways. It brings your fight and flight and rest and digest systems, parasympathetic nervous system and sympathetic nervous system in a balance, which is the key for everything, right?
Mhm.
If you are very nervous and you have to take a test, what happens? You start to forget everything,
Mhm.
right?
Yeah.
So at that point, if you know how to breathe, you can bring the fight and flight down and you can bring rest and digest up. And that would help you to be able to think better and adopt your tests and your exams a little bit better. So, breathing is the first exercise which I would tell all of you to do. Number two, walking. What you guys do is you sit in class for at least 2 hours, right?
Mhm.
What happens? When you are sitting, your core is kind of like, okay, you are supported, you don't need me. And core kind of lets go for a little while because it's a posture. It's posture
Yeah.
muscles. The posture is not, in your standing posture, you need more muscles than sitting posture. So people who sit for a longer period of time, like you are sitting in class, you're watching TV, you're watching a movie, you're playing a video game. Guess what we do? We are sitting like this all the time, right?
Mhm.
So our muscles are not active. So what happens in the long run is that these muscles start to lose their strength. They start to lose um, their uh, their proper activation.
Mhm.
Okay, so I have seen a lot of kids and teenagers who play a lot of video games and they get constipation
Yeah.
because they're sitting for long periods of time. They're not activating the things, and then when they are playing video games, their sympathetic nervous system is so high. They are in immersion there. They need to
Yeah.
kill this person. They need to go forward. The fight and flight mode is way too active. What happens afterwards is the flight and flight mode is high, although they're done playing that video game, but their system stays high because
Yeah.
they're not breathing very well. They're sitting the way they are compressing all their proper the muscles which need to do give them better breathing. We need to activate their core. So their behavior change, their anxiety levels change. They have more of anxiety than they've had when they sometimes people go in there to play so they can feel relaxed so they can go back to their studies, right?
Mhm.
But when they come out of that, their anxiety levels are much more higher than what they went into there. So it's harder for them to focus on their studies or the work they're doing. So at that point, if after you play for maybe an hour or you sit in 2 hours, you gotta stand up and walk for
Yeah.
maybe 10 minutes or 15 minutes. After every meal, you should be walking for 10, 15 minutes. If you can go for a walk, not run, just a fast, brisk walk, that can help with all kinds of issues which can be created from long time sitting, right?
Mhm.
So that would be very helpful for teenagers to do that. To not sit for long and stand and walk more.
Okay.
Another thing, the third exercise, which I would recommend for everyone, is to exercise to 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 exercise the body. Feel what is where, to be aware of your body. Okay? It's a brain exercise. Understanding what your body is feeling, where your body is, where your muscles are, is very important. I would suggest that the breathing, I would suggest do it several times a day. Walking, especially when you do 1 or 2 hours of sitting, standing, and walking for 10, 15 minutes, very, very important. Throughout the day, walking, after the meal, walking is very important. But this exercise, the third exercise, is the brain exercise. Every night when you go to bed, you go from bottom to top, from head to toe. Feel what your muscles are, where your body is, how is it feeling. When you inhale, inhale deeply into that specific area, and then exhale. This would make you more aware of your
Mhm.
body. And then once you get the muscle by muscle, step by step, try to squeeze those muscles, tighten those muscles. Like you are, try to do it this way. Try to tighten up the eyes muscle and relax. Tighten up really hard and relax. Now wrinkle your nose and relax. In your mouth and relax. Tighten up your neck muscle and relax. Right? Your shoulder muscle, relax. Bring your shoulder blades together and relax. Move your arms up and down and relax. Just tighten up the arm muscle like you are picking up something very heavy and relax. Just doing this,
Mhm.
doing on the top body. Feel what your top body feels nice and active. Blood is moving. And your bottom body feels, something is wrong. I feel achy a little bit, right?
Yeah.
Did you feel that one? Now, let's do something. Let's do move your toes up and down. Okay? Tighten up your leg muscles. Try to squeeze your glutes. Feel that you're going up. When you squeeze your glutes, you're going to feel that you're moving upward. Squeeze your glutes and relax, let go. Squeeze your glutes and relax, let go. Right? Now, do you feel nice and active?
Mhm.
You feel more relaxed. So we can do this anywhere. You can do it in the school, but when you before your bedtime, lying down, you can go over that every day, and that can help you to improve your body awareness, understanding where your body is, where the tension is, and how to relax that, and get you ready for a new day or a new task you need to go to. All right, there goes the three exercises.
Okay, so let's move on to the next segment of our podcast, which is common myths about physical therapy in general.
Okay.
So, the first one, I don't need to attend physical therapy until I'm old.
That is not true. That's it for sure. We see patients throughout the walks of life. I have
Mhm.
patients who are 5 years old all the way to they're 90 years old.
Oh,
So a lot of teenagers we are seeing, and in pelvic wellness we are seeing them. The again, for physical therapy, don't go for physical therapy just for the sake of when the problem happens. It
mhm.
should be coming before the problem happens. for the wellness part of it. So all you need to do is go to your doctor, and because New Jersey, although we are direct access, but what happens is that um, in New Jersey, because Medicare wants doctor script, so all insurances want doctor script. So it would be a good idea to get a script from the doctor for um, um, physical therapy for whatever reason, for muscle training or for strengthening or something like this, and then you can go to the doctor, to a physical therapist, and can get those treatments. So definitely a busted myth. You gotta go whenever you need it.
No, that's good because we busted that myth. I feel like that was a really big misconception to be addressed.
Yeah. It is
So
definitely a misconception.
for our next one, physical therapy is just exercise, nothing else.
Absolutely not. Absolutely not. Physical therapist is actually a kind of combination of all physical needs which can help you. Yes, exercise is a big part of it, right? Exercise is definitely a big part of it. But how to manage, how to, like, multiple things, the nutrition wise, we will be able to give you the advice. We will be able to, the water intake, how to change your everyday activities in life, what you can change in your throw, what you can change, how you move, how you change your posture to improve your ability to be able to throw better or bat better. We can help you with that. Not just this. We do have a lot of lot of um, uh, modalities we can use, like biofeedback. Biofeedback is a modality where the muscle is picking up the EMG signal and it can tell us how strong the muscle is. So if you need to see how strong you are, we can actually put the EMG and we can put it in numbers how strong your muscles are. So we can give you, yes, you did that during this mobility, you activated, and then we can see how the muscles are coordinating. We can use the biofeedback to coordinate the muscles to see. So that is another thing. We do have laser therapy. We do have multiple other kinds of therapies which really help. So exercise is a part of it, but we have a lot of other things which we offer.
Very interesting.
Yes, it is.
Okay, so the next one. I can just search up exercises to do at home instead of attending physical therapy sessions.
This is such Mr. Google is kind of drives me nuts some days. I have actually seen patients who had back pain and who have abdominal pain, and they went online, got the exercises, and then they are, then by the time they come to me, they're like, I cannot walk. I started doing these exercises and they are in severe pain. The thing is, when a physical therapist does that evaluation, they don't just give you a random thing. They look at you, they assess what they know. Okay, if this pain is happening, this, and this can go wrong. Right? Or if you're not able to throw, you might have weakness here, and here.
Yeah.
So what they do is they do the assessment on you. They see where the weakness is. You might have beautiful upper arm strength, but you're not able to coordinate proper breathing with that for you to be able to generate proper abdominal muscle pressure or the hip stability to do the throw. And that is the reason your throw is not as fast or your throw is not as strong, right?
Yeah.
So we as physical therapists can assess or see where the weakness is, where the problem is, and then we can work on that to make it better for you. So for every person, it's different. What they show on Google is very generalized thing. That is not for you. that is for just throw in the out in the open, and whoever catches it, whatever catches that, right? That's one thing. Another thing is that we need to look at specific way you do the exercise. When they give you the generalized exercises, yeah, I can do that and I will do that. The generalized exercises doesn't give you the fine tuning of the exercise. Like if you do me this favor, take a slow full breath in and move your arms up. Come on, let's do that. Arms up and down. Now, I want you to, right here, hold your breath, tuck your abdominals in, right? Tuck them in and move your arms up. Now, tell me, were you able to do both the same way?
No.
Yeah. It's very hard to move your arms up when you had the abdominal tucked in, right?
Yeah.
So this small thing, in videos, they don't tell you what is coordinated with what you should be doing to make it better, to improve the range of motion. So understanding these little fine tuning things is important for your recovery, for your better to achieve, for your goals, for you to achieve better goals, right? To
Yeah.
achieve your goals. So that's what, as a physical therapist, we give you.
Okay. So we'll move on to a scenario question now.
Okay.
Let's say that an individual is, doing their regular exercise routine when they notice a sharp pain in their knee. What can the individual do in that particular situation?
Okay. So the very first thing they should be looking at it. Okay, is it just one time I felt this pain, or every time I move and do this movement, I feel this pain?
Mm-hmm.
Okay? So, and then sometimes it happens that the way you put your foot, or the way the leg is aligned, is not very supportive for your knee, and your knee wants the support. So it screams to ask for that support, right? So you got to change the way you're putting the pressure on the knee. But definitely, they need to understand if they are putting that pressure the right way.
Okay.
So if this pain is there, they need to see if it happens all the time, or it happens in a certain movement, every time they do a certain movement, or it just happens once in a while. You just need to fix the way you are standing, and then it will go away. Then you don't try not to go into that specific position the same way.
Okay.
All right.
And for our last question.
All right. We survived.
What is your take on Google Doctors?
I think you already got my idea. The Google Doctors are okay. So they do discuss, the Google Doctors do tell you the generalized information.
Mm-hmm.
What we as humans do is, when we listen to them, and we see, okay, one is applies on me, two applies on me, three applies on me, and then we take it on our heart and like, oh my God, I have that. You try to do the self-diagnosis, which is definitely not the best thing to do, because reason for every pain can be entirely different from one person to the other. Although the pain intensity is the same, the pain duration is the same, the pain the kind of onset is the same, but the reason for that pain can be entirely different from one person to the other person. Now you go to the doctor, the Google doctor, or the mock Dr. Google, and they tell you, oh, this is this reason, this reason, this reason, this reason. And you pick up your diagnosis, which might be entirely wrong. It might be right, but it might be entirely wrong for you. Then it will be for another person. So in my opinion, that is not the best source or resource you should be consulting.
Yeah.
So, in my opinion, that's what I would not want to go to a generalized opinion to get my individualized problem.
Yeah.
So,
I completely agree with that too.
I'm glad that you do.
Okay,
Okay.
so our podcast session has now come to a close.
Okay.
I would like to thank you once again for your time, input, and contribution.
Thank you so very much for inviting me and giving me the chance to talk to everyone.
It was a pleasure.
Absolutely.
And for our listeners, we have a slogan from our doctor.
Yes. So actually, the slogan is from Eshika, and I will. So what he wants to say is, nourish your habits to flourish your lifestyle. This is a good slogan, right? Nourish your habits to flourish your lifestyle.
And don't forget to follow us on our website, HealthyTeens.net, where you can view all of our podcasts as well as other information. And stay tuned until our next episode. Thank you.
Bye, guys.